Introduction to Haematological Malignancies. By Tiffany Shaw. MBCHB2. July 2002. Common malignancies: acute chronic lymphoid myeloid, acute lymphoblastic leukemia, chronic lymphocytic leukemia, lymphoma, myeloma, myeloid, acute myeloid leukemia, chronic myeloid leukemia, acute leukemias. Definition: a malignant disorder in which hematopoietic blast cells proliferate and constitute greater than 30% of the bone marrow. Lymphoblasts: lymphoblastic leukemia, myeloblasts: myeloid leukemia. Acute leukemias: PC bone marrow infiltrated by blast cells. Bone marrow failure, pancytopenia, anemia, fatigue, SOB on exertion, thrombocytopenia, bleeding, DIC, neutropenia, infections. Constitutional symptoms: malaise, anorexia, night sweat, fever, lymphadenopathy, hepatosplenomegaly. Acute leukemias: X, low HB, low platelets, high WCC, increased blast cells, low neutrophils, elevated serum uric acid. Bone marrow biopsy, infiltration by blast cells. Acute leukemias, risk factors: familial, Down's syndrome, viral infection, EBV Burkitt's, radiation, chemotherapy. Acute leukemias, AML versus all. Myeloblastic, any age. 1/3 transformation from other myeloproliferative disorders. Increased DIC. All. Lymphoblastic, commonly children. Primary event: more lymphadenopathy and hepatosplenomegaly. Acute leukemias, classification: French-American British classification. Morphology, cytochemistry, immunophenotype, cytogenetics, DNA analysis. Examples: AML, promyelocytic, myelomonocytic, monocytic erythroid. Megakardioblastic, undifferentiated. ACT, all. Small cells, large cells, vacuolated basophilic blast cells. Acute leukemias, MX, supportive RX, anemia, blood transfusion, PRN, bleeding, platelets, PRN, infection, antibiotics, PRN, social support plus issues. Acute leukemias, MX, chemotherapy, remission, induction phase, consolidation phase, maintenance phase, for all. Prednisone, daunorubicin, vincristine, thioguanine, cyclophosphamide. Acute leukemias, MX, bone marrow transplantation, high-dose chemo RX. Removal of stem cells from donor. Transplantation into recipient. Acute leukemias, prognosis. AML. 30 to 40% cured. Varies widely with age, comorbidity, etc. All. In children, 70% cured. In adults, 30 to 40%. Chronic myeloid leukemia. Increase in neutrophils and their precursors. Really a myeloproliferative disorder. Greater than 95% patients have chromosomal mutation, Philadelphia chromosome. CML, PC. Constitutional symptoms: anorexia, weight loss, fatigue, night sweat. Splenomegaly, hypochondrial pain. Asymptomatic, incidental finding. CML, X, increased WCC, neutrophils and precursors. Later bone marrow failure, anemia plus thrombocytopenia. Raised serum B12. Raised serum uric acid. Bone marrow biopsy, hypercellular with high myeloid erythroid ratio. CML, course/progression. Chronic phase. Raised WCC. Constitutional symptoms, asymptomatic. Accelerated phase. Anemia plus thrombocytopenia. Splenomegaly. Bone marrow fibrosis. Acute phase. Transformation to acute leukemia, 80% AML, 20% all. CML, MX chronic phase acute phase hydroxyurea interferons chemo-Rx. Bone marrow transplantation. Acute phase. Same as acute leukemia. Chronic lymphocytic leukemia. Increased lymphocytes, B cells, in the blood, bone marrow, lymph nodes, and spleen. Lymphoproliferative disorder, CLL, PC asymptomatic lymphadenopathy. Constitutional symptoms, night sweat, weight loss, anorexia. Symptoms of bone marrow failure. Splenomegaly. CLL, X lymphocytosis, B cells, low serum agrased serum uric acid. Bone marrow biopsy lymphocytic infiltration, CLL, X depends on stage ABC. Less than 3 lymph node groups involvement. Blood's normal. Greater than 3 lymph node groups involvement. Blood's abnormal, anemia plus thrombocytopenia, CLL, MX observation, stage A. Chlorambucil-Po, lower lymphocyte count and lymphadenopathy. Corticosteroid. Fludarabine 4. Other chemo-Rx. Supportive care.